Ladies and gentlemen, first of all, good afternoon. My name is Ele Ferranini. I am from the University of Pisa, Italy, which is exactly 3,000 kilometers south of here. And I'm going to be chairing this symposium this afternoon, and I'm delighted on behalf of the faculty and also the sponsor to welcome you to this discussion. You see the title, it says, should type 2 diabetes management be more of a priority in post-acute coronary syndrome patients? And it's posed as a question, but it kind of implies the answer that it should be more of a priority. And these are my disclosures. The objectives in particular are to discuss the current management of type 2 diabetes in post-ACS patients. And in doing so, we're going to be looking at both cardiologists and the diabetologist viewpoint, although there is a predominance of cardiologists in the faculty. Then we will explore the clinical implications of the cardiovascular outcomes trials that have assessed the cardiovascular safety of oral antidiabetic drugs in post-ACS patients with type 2 diabetes, whatever data are available. To debate these outcomes data in terms of how they impact on the optimal management of type 2 diabetes and what gaps there are in the data that need to be addressed by future studies. And then agree on the optimal management of diabetes in post-ACS type 2 patients, trying to complement the cardiologist with the diabetologist viewpoint. I don't need to emphasize to this audience how critically important this topic is, given that cardiovascular disease is still 2-3 times as prevalent and incident in patients with type 2 diabetes compared to the background population. Just think that 30 years after the UK PDS study, 50%, half of those patients are dead, and the great majority, the vast majority of them are of a cardiovascular cause. You have the agenda, you have the smiling pictures of our speakers. We'll start with Professor Jean-Claude Tardif from Montreal in Canada, who will take us through the ACS patient journey. Where does diabetes fit in? Then we will have a cardiologist, Professor Stephen Nichols, who's come from down under in Australia, who will give the cardiologist perspective for diabetes and cardiovascular risk management in post-ACS type 2 patients, and Professor Jürgen Rudby, who's from Denmark, who will give the diabetologist perspective. Finally, we will recapitulate what we know, and Professor Fayez Zanad will do that. He's from Nancy in France. What we know about the safety of oral hypoglycemic agents that has become such a big issue in recent times in post-ACS patients with type 2 diabetes, and explore the evidence from recent outcomes study. Now, the format is going to be that after each presentation, we will have some 5 minutes or so for burning questions from the audience. And then at the end, as you see in the agenda, we'll have the panel together for a general discussion, which I will try and facilitate. And again, Professor Jean-Claude Tardif has a close flight, so I think without further ado, I would like to invite him to start with his presentation. Jean-Claude, please.